Hello, welcome to the Inspire and Ignite series from Safe States Alliance. This month, we're talking about the landscape of injury and violence prevention work. You're watching part one, our recorded webinar where subject matter expert Eva Bland walks you through a tool Safe States created to map out the field of IVP. Once you finish the video, take our survey to let us know what you thought and what questions are still on your mind. And after that, register for part two, an interactive group discussion where you'll get to connect with other practitioners and talk about the strengths and challenges in building out the injury and violence prevention field on June 26th. Hope to see you there.
Hi everyone, and thanks for taking the time to watch this Ignite video. For this video, I'm going to go over how Safe States is mapping out injury and violence prevention and connect some of the key concepts that often get lost in our journey as we talk about IVP. If you are new to Safe States, we're a national nonprofit organization and a professional association whose mission is to strengthen the practice of injury and violence prevention. My name is Eva Bland. It's nice to virtually meet you all. And I'm the Associate Director of Training and Workforce Development here at Safe States. As part of my role, I get to oversee the portfolio of work Safe States is doing in regards to shared risk and protective factor approaches, as well as working with the team on building out resources and learning experiences for the field of IVP. I have a really unique view of injury and violence prevention. Because my role in working with a national nonprofit, I get to see and hear and learn from practitioners all over the country about what's working, about where there's confusion, and opportunities for growth. In recent years, the fundamental questions at the root of public health have shifted from addressing single specific issues to focusing on the systems of well-being holistically. For injury and violence prevention, that's often resulted in us talking a lot about shared risk and protective factor work and upstream prevention. And I personally have seen this shift and this change in the work we're doing at Safe States, as well as the work our members are doing. It's something I've spent a lot of time thinking about over the last 10 years, and it's led to kind of where we are today and some of the things that I'm going to talk about today. So, as I mentioned, Safe States is a national nonprofit, so we get to hear from partners across the country around things that are happening within injury violence prevention. And one of the big things that we do is take those lessons learned and develop an array of resources. So if you've been to our website, hopefully you've encountered quite a few of these resources and hopefully participated in some of them. And if you haven't, please do. I invite you all to join safestates.org and check out some of our resources. Most of them are publicly available, if not almost all of them. We're constantly thinking about resources and toolkits that might help the field, and I've listed a few and that hopefully you've all heard about. Two resources in particular have been developed to help the IVP field think more upstream in terms of their work. The first is IVP 360. This is a comprehensive self-studies series that covers key concepts and foundational elements. It also provides tools and resources to assist in program planning, implementation, and evaluation. Some of the sections included in IVP 360 includes looking at injuries and violence as a public health problem, understanding the foundation and critical terminology, the critical skills needed for IVP and the foundational elements of IVP, as well as health equity in IVP and providing tools and resources connected to those different topics. Another resource that we developed in the past couple of years is called the Connections Lab. And this was developed in response to the field's need of resources and trainings related to shared risk and protective factor approaches. So while both of these resources have been extremely helpful in explaining what IVP is and what shared risk and protective factor approaches are, we were still hearing from members that it wasn't inherently clear on how all these pieces connected. And so that really led us to start thinking about, well, what is IVP? How do we explain it as a field? What are the ways and what are the resources that we have that might be helpful for members and people who are just learning about injury and violence prevention in general? The questions around how to connect actual IVP work and theoretical approaches like shared risk and protective factors isn't a new issue. In 2022, Safe States released a report about looking at how states are implementing shared risk and protective factor approaches and the barriers that exist around this work. And far and away, one of the biggest issues that we heard was around language. It's confusing. It's confusing when you're trying to shift for the field of injury and violence to focus on upstream systems like shared risk and protective factor approaches. We have to find a way to talk about it to both and explain it to both colleagues as well as partners in a way that's clear, that they understand. And at Safe States, we realize that people need both the why and how of what injury and violence prevention is and have it very clearly laid out and how all of these different concepts connect. So among the questions we kept hearing were, what is upstream prevention and how do I explain IVP to my partners? What is health equity and why is it important to IVP work? How do I connect that to what I'm already doing? What does IVP look like in practice? And how do I connect shared risk and protective factor approaches to the work I actually do? What does the field of injury and violence actually look like? These are questions that, we've heard from members, we've heard from our own colleagues have had these conversations. So we really wanted to try to develop something that would help connect things a little bit more clearly. So in the spring of 2025, Safe States launched Mapping Out IVP. This is a site dedicated to providing a deeper understanding of how injury and violence prevention is practiced and connect people to resources that Safe States has. Okay, so I've moved us over to the Mapping Out Injury and Violence Prevention page, just to give you guys an idea of what it actually looks like and how you might navigate around on it. Right now, I'm on the home page. This overviews the 5 different concepts that we have highlighted, or what we're calling the stops along the way as you expand your injury and violence prevention knowledge. And so on this page, you can really kind of figure out which path you want to take, where you want to start. We designed this site so that we start very, very broad with the concepts around working upstream, what that looks like, talking about what primary prevention is, how we do primary prevention as injury and violence prevention professionals. And then we start, as you go from stop to stop, looking a little bit more in depth of each of the concepts. So foundations and concepts focuses on thinking about shared risk and protective factor approaches, how that connects to social drivers of health and health equity, and talks about some of those larger concepts connected to injury violence prevention. The Centering Equity page really looks at what role equity plays in injury and violence prevention, and how we're centering it. So within this page, we think about and we look at systems of power, understanding our own bias, and how things and concepts like this really impact the work that we're doing. The in practice page is going to be information that really is about how to carry out this work in your day-to-day life. So within this section, we're looking at evaluation strategies. We're looking at funding strategies, especially around braiding and blending of funding. We're looking more closely at what a theory of change model looks like, especially theory of change model connected to shared risk and protective factor approaches. And then finally, the field page, which looks at what is happening in the field of injury and violence prevention. Where are we actually practicing injury and violence prevention? What it looks like at a state health department, at a local health department, what is the policy work that we're doing around injury and violence prevention, and it even touches on different onboarding resources that might be helpful for people who are in the field and working in injury and violence prevention. The hope is that this site really connects some of the really big concepts of what injury and violence prevention is to how we actually do it and what it actually looks like in practice. So within the stops, we'll go to, let's say, foundations and concepts, stop 2. You'll see that you can navigate from stop to stop if you want to up here. But you can also always go back to the home page as well. But within each stop, you're going to have the slide deck that talks about this in depth for you to look at and to self-study at your own pace. You can do it just by looking at the slide deck. I also have the notes available, so if you need a side companion of notes to go with the slide deck, and they're also recorded as a full video. So as a full video, there's auto narration, auto commentary with it as well. So you can watch that and just as you would be watching a presentation like you are right now. Below the slide deck are resources worth exploring. So each of these resources are Safe States resources that are directly connected to each of these different themes. So we have a lot of resources on our page, and one of the things we've heard is that it can be difficult to connect some of these resources or to find these resources. So we wanted to make that easy, and we wanted to make sure that everybody was aware of where they are and how to find them. So within each section, you'll find a companion of resources that are related specifically to that topic area. And then at the very bottom, we have just some general Safe States tools that are going to be relevant to every section. So they're included within every stop, and that's the IVP glossary, our training and resource hub, where you can search for all the different trainings and webinars that we've ever done. They're all going to be included in our training and resource hub, as well as our case studies. We have a lot of different case studies from over the years, and we've put them all on one page, and you can access them here. So you've seen a map, and you can examine more closely on how we explain IVP on your own by going to the Mapping IVP website on Safe States. But I thought it might be worth looking at some of the key concepts in injury and violence prevention that can often be confusing to explain, that some of the questions for the development of the site came from. As we talked about before, language can be confusing, especially when we are starting to use different jargon words. So let's break down what injury and violence prevention is and how some of the concepts that we hear about connect. We start our journey by explaining primary prevention and its characteristics. Why do we start with primary prevention? To level set. There are lots of different people doing lots of different work in prevention, from those working in highly individualized person-to-person prevention activities to those working on larger population level activities. Explaining primary prevention can be critical in gaining buy-in and understanding from partners and sometimes even colleagues. To put it simply, primary prevention refers to the activities that take place before injury or violence. Our mapping IVP site goes more into depth about what this actually looks like, but generally, primary prevention is population initiatives that address the underlying issues impacting injury and violence prevention. Once we explain what primary prevention is, we have to then explain how we do it. To do this, we have to explain what affects the health of a population. This is when we begin to look at the social drivers of health. Social drivers of health are conditions in which people are born, live, learn, work, play, worship, and age. The non-medical factors that influence health outcomes. Social drivers of health have a significant impact on health in a wide range of forces and systems shape the daily life of a population. Social drivers of health can contribute to health disparities and behaviors, such as violence and injuries. Outlined on this slide are just a few examples related to each social driver of health. When the conditions of the social drivers of health are inadequate, you can create unfair yet avoidable differences in health statuses. So, to work in primary prevention means to work on the social drivers of health to build safer communities. It's important that our strategies aim to positively impact these social drivers of health. Well, how can we have the biggest impact with IVP strategies? It goes without saying that making a change at the societal level or the population level is very difficult. These types of changes are not only difficult, but also complex, which even explaining injury violence prevention can be very complex. So preventing them and actually doing the work, not surprisingly, even more complex. Knowing that finding the right strategy takes time, as practitioners, we must always ask ourselves how we can have the biggest impact. And this is often where the idea of shared risk and protective factors approaches come in. So, as practitioners, we probably know that we have the biggest impact in prevention by focusing on upstream strategies. So that includes focusing on large populations, changing policies, changing culture, talking about cultural norms, as well as developing strategies that aim to positively impact the social drivers of health, which we just talked about. And acknowledging and understanding the systems of power impacting the population you're working with, and creating strategies in a collaborative, inclusive manner that acknowledges the impacts of trauma on population with whom you're working. So, shared risk and protective factor approaches is a helpful way to reframe your thinking and prevention strategies and carries out each of these features. The shared risk and protective factor approach reframes our thinking of prevention strategies. With a shared risk and protective factor approach, we're really focusing on the protective factors or risk factors, the protective factors, or instead of the individual outcomes. So instead of looking at an individual outcome, we are looking at many shared outcomes. So on this slide is an example of a shared protective factor, which is support for resource-limited families. This is a protective factor for the outcomes related to any outcomes related to intimate partner violence, gun violence, and child maltreatment, among a few. One of the places that I hear confusion, or I hear people saying that they're confused about, is how health equity fits into our shared risk and protective factor approaches. For our strategies to impact the social drivers of health positively, we have to acknowledge and understand the systems of power impacting the population we are working with and the work we are doing. This requires creating strategies in a collaborative, inclusive manner and ensuring that everyone has a fair chance to be healthy and safe, regardless of the background. It requires addressing systemic injustices and barriers that contribute to unequal access to resources and opportunities, which can increase vulnerability to injuries and violence. So, health equity is really at the center of the work that we do. To ensure we are centering health equity, it's imperative that we carry out a DEIJ practices into the work we do. So this includes acknowledging and valuing and including a diverse group of people and cultures and ideas and even traditions into the work we do. It includes taking action, ensuring that equity and policy and practice is included. Ensuring inclusion, it also means ensuring inclusion via power, maybe that's voice or organizational culture, and justice with equal rights and equitable opportunities. So it really all connects, all of these different concepts. They come together and they connect. IVP means working in primary prevention space, creating shared risk and protective factor strategies focused on impacting the social drivers of health with health equity centered. By focusing upstream and developing a more collaborative approach to prevention, the public health system has a better opportunity to reach more people. We know this as practitioners, and it's something that we think about on a regular basis potentially, but explaining it and being able to walk through it can be really difficult because these concepts are super complex, overlapping, and just large. So being able to explain that in a way that is relevant and impactful with partners can be difficult. I hope that our Mapping IVP site will help with providing a deeper understanding of how injury and violence prevention is practiced and also connect you with the resources you need. I shared some information from just a few of the stops within our guide. I certainly go into way more detail within the guide itself when you're on the Mapping IVP site, but I just wanted to connect some of the concepts today and give you all an idea of what it might look, of what our site looks like, and how things connect. This road, it's complex, but hopefully having a map to follow will help you on your IVP journey. The link to the Mapping IVP site will be included on the notes of this video, and I really would love to hear from you. I hope you'll join us for the Ignite conversation. This will be held on Zoom meetings. You can register for it now. It will be on June 26th at 2:30 p.m. Eastern Standard Time. And this is really going to be an interactive meeting where you'll have a chance to kind of reflect on the challenges that you've been having and moving more upstream, as well as communicating about injury and violence prevention. It's always helpful to hear from people in the field, so hope you might join us. And thank you very much.